other healthcare professionals. Today I want to talk to you about warfarin and the use of it when we do have new patients taking it, and what any side effects, indications, contraindications, and the pharmacology behind it. So as we know, warfarin is an anticoagulant drug that is used to prevent the blood from clotting, or it slows down the development of blood clots that have already formed. It's often referred to as a blood thinner. However, that is not true. It doesn't necessarily thin the blood, it just slows down the formation of blood clots. It's used to lower the risks of blood clots forming to prevent cases like a stroke or blockages in the veins or the lungs, such as pulmonary embolisms or deep vein thrombosis. What warfarin does is it blocks the enzyme clotting factors, reducing the production and the disruption of the clotting process. Warfarin is often prescribed to people who are at risks of developing harmful blood clots, whether they already have a mechanical heart valve, they have a regular heart rhythm, they have certain clotting disorders, or they're at risk of a blood clot post-surgery, whether it be hip or knee. It's also used for people who've gone through a stroke, a heart attack, a pulmonary embolism, or have already had deep vein thrombosis. Some contraindications of warfarin is anything, because it's sort of may cause the effects of excessive bleeding. Some indications would be people that are at risk of hemorrhaging or having blood dyscrasia, which is findings of abnormal materials in the blood. Anybody who's had surgery to the central nervous system, or anybody who's had traumatic surgery to any large open surfaces. People also need to be mindful that there is regular blood tests that are involved with taking warfarin, so they need to obey the monitoring procedures that involved. So clients that aren't willing to go forth with that would not necessarily be given warfarin. With the dosage and monitoring of warfarin, it's generally monitored through laboratory studies looking at the thrombonin time, and then that is balanced out between an international normalized ratio, which sort of shows you how much time the blood should take to clot and whether it's too fast or too slow. A longer clotting time would result in a higher prothrombin time, and that would increase the INR, which is the International Normalized Ratio rating, and it should really be found somewhere between 2 and 3, but it is also determined on the certain client and their clinical findings. Most people who would be on warfarin should be at about a 1, which would be great. So if patients are found to be below their optimal range in their INR, they would be at an increased risk of blood clots, an increased risk of bleeding, And so in this case, this is when regular blood tests are used to monitor how much of a dosage the patient should be given, or whether, If a client is to also monitoring their dosage, being informed of whether they have brought in new medication or taken out a medication of their current findings, because it does interact with other medications as well, would also be important to know from clients. So the main brand that's prescribed across Australia is Coumadin, and it comes in 3 different strengths to they're the general ones. We've got a 1 milligram, which is found in light tan, a 2 milligram, which is lavender, and a 5 milligram, which is green. So Coumadin inhibits the synthesis of the CI subunits of vitamin K enzyme complex, and this will reduce the regeneration of vitamin K. They don't have a direct effect on the establishment of thrombus, but they don't have any reverse ischemic tissue. They don't give any, They don't damage any ischemic tissue. If a thrombosis has already formed, however, anticoagulant therapy is used to prevent the formation of further clots and any secondary thromboembolic complications. So when there isn't any warfarin being used, what happens in the body is that the vitamin K builds up and it produces these blood clotting proteins, and that links to the blood cells and it brings them together and it forms a clot. When warfarin is introduced, however, it reduces the amount of vitamin K that is produced, limiting the amount of proteins, which means that blood cells can free flow through the body. So coumadin is made up of R and S inhibitors. S inhibitors have a larger anticoagulant activity than the R inhibitors, but has a faster clearance throughout the body. Coumadin is commonly administered orally, and it hits its peak concentration about 4 hours after taking it, and then it's distributed quite thinly throughout the body, and the distribution phase can generally last anywhere between 6 to 12 hours. Coumadin is metabolized by the hepatic microsomal enzymes, which is the cytochrome P450, and that inactivates hydrolyzed metabolites and reductase to reduce metabolites. The metabolites found in warfarin are dehydrowarfarin. There are 2 diastereomyl alcohols, and then there's 4, 6, 7, 8, and 10 hydroxywarfarin, also found in the coumadin metabolites. The cytochrome P450 isosome complex include the 2C9, the 2C19, 2C8, 2C18, 1A2, and 3A4. 2C9 is more predominantly found to modulate the in vivo anticoagulant activity of warfarin in the liver of the P450. And then these metabolites are then excreted into the urine and the bile. And in the bile, however, it's not as high of a concentration. So warfarin does interact with other, whether they be drugs, alcohol, or other vitamins. So the main vitamin that warfarin interacts with is obviously vitamin K. So it's always important to be mindful of these interactions that medications have with each other, as to not prescribe something that will harm our client, and we know that there may be some complications if something were to mix with the wrong type of drug or herb or alcohol. So vitamin K will decrease the effects of warfarin, and it will increase the risk of blood clotting. As I said earlier, the more vitamin K, they create more protein enzymes, and that leads to a blockage. So it is advised that when patients are on warfarin, that they still include vitamin K in their diet, but as a well-balanced amount throughout the day, and depending on their select dosage, that they are mindful of how much vitamin K they are to ingest. Vitamin K can be found in all of your leafy green vegetables, your broccoli, your cabbage, kale, spinach, lettuce, and Brussels sprouts, which are quite easily accessible and great to include in a healthy diet anyway. Cranberry juice and grapefruit juice are also found to affect the use of warfarin. So it's advised that if clients were to drink either of these juices, they were only to have no more than 2 glasses a day. Warfarin does interact with alcohol. Alcohol does not really have any bad side effects, but if you were to consume a large amount of alcohol, it would it will increase the INR rating, and it could increase the risk of bleeding. So warfarin, like we said, interacts with other drugs. There's roughly about 250 drugs in sort of research that is found to interact with warfarin. These drugs are generally antiarrhythmic and anti-inflammatory in nature. So these could be drugs. So these agents could be such as amiodarone, morphine, propafenone, and quinidine. And then your over-the-counter drugs like ibuprofen, aspirin, and naproxen can also enhance coagulant effects, increasing harmful bleeding to the patient. Certain side effects of taking warfarin is any sort of bleeding. So this could be excessive bleeding or hemorrhage. It could be things as bleeding from the gums, blood in the urine, bloody or dark stool, nosebleeds, and then vomiting blood. Warfarin may also result in a skin necrosis or gangrene, and this is generally associated with a protein C deficiency. And this can come from an inherited clotting disorder in some people. Warfarin in pregnancy is often not recommended, as the warfarin can pass through the placenta and cause certain birth defects, interfering with normal blood clotting and the formation of bone and cartilage in the fetus. However, other anticoagulant medications can be used during this time that are less harmful for the child in the womb. Warfarin, however, can still be used while breastfeeding. It does not pass into breast milk, so it is safe for mothers to either start taking warfarin or come back onto it postnatal. Other side effects that should be notified, or should you inform your healthcare professional, would be things such as severe or unusual headaches, any confusion, weakness, numbness, coughing up or vomiting blood, blood in general, non-stop bleeding, or bright red blood in your stool. Pain, swelling, bruising, or bleeding from the gums after you brush your teeth, swelling or pain at an injection site post-vaccination or anything, excessive menstrual bleeding, diarrhea, vomiting, or the inability to eat for more than 24 hours, fever, which could mean there could be a risk of infection, or any other medical prescription that they may have been given, should all be reported to their healthcare professionals. So that's a little bit about warfarin and what clients or what patients should know about warfarin before they start taking, or after they start taking it, just be a little bit more mindful. So have a look through the pamphlet, and if you have any other questions, there are relevant resources that we can look at to provide more information in depth. Thank you.